While Washington looks at trying to solve the nation's health care crisis, a lot of Americans aren't waiting around. They are willing to take matters into their own hands by seeking medical treatment elsewhere. A new Gallup poll shows 29% of those surveyed would consider traveling outside the U.S. for treatment in a foreign country. 24% would travel for cancer treatment or diagnosis, 15% for a hip or knee replacement, 14% for heart bypass surgery, and 10% for plastic surgery. When people are asked if they would consider treatment abroad, assuming the quality was the same and the costs much cheaper, all those numbers jump by an average of about 12 points. Medical travel used to be considered a luxury for the rich, but with health care costs at home skyrocketing and an estimated 48 million Americans uninsured, that may no longer be the case. In fact, this same Gallup poll shows people without insurance are more likely than those with coverage to think about going abroad for medical treatment. When it comes to regions of the country, those in the West most willing to travel, people in the Midwest and South least likely to want to go abroad. Meanwhile, if there are improvements in insurance reimbursements, hospital quality, and cheaper costs abroad, more Americans could start traveling elsewhere for health care. That's the question. Would you be willing to travel to another country in order to get medical care? Go to CNN.com/Cafferty file and post a comment on my blog.
There are so many stories about these desperate people willing to do almost anything for the appropriate medical care, Jack.
You also hear stories of raging successes where they go for sophisticated treatments. The prices are much cheaper than they are here in the States, and everything turns out fine. So we'll see what kinds of experiences our viewers have on this.
I'm anxious to hear it. All right, Jack, thank you.
Question this hour is, would you be willing to travel to another country in order to get medical care? Lisa in New York writes, I would travel abroad for medical care, even if it weren't as good as what was theoretically available here. Being able to afford some health care is better than not being able to afford any at all. J.S. in North Carolina, I lived in the U.K. I would go there any day for medical care. It was far better than what we have here. My husband had surgery for an aortic aneurysm. He spent 10 days in the hospital, had the finest specialists, care, fabulous follow-up care. The cost? Zero. And he paid nothing into the system, being an American citizen. Marcos in Sao Paulo, Brazil. I work near a hospital here whose staff is required to speak fluent English. So many Americans and Europeans come here for the reasons you cited. It's not a season fever either. It's been happening for the last 3 or 4 years, and it's growing every year. Travis writes, I would and already have traveled outside the country for medical treatment. It originally started when I was in Japan for a vacation, and I found out how much better their health care system was than ours. You know what it cost me? Absolutely nothing. Elle writes, my retired parents recently traveled to Mexico for dental work, and they plan to return this summer. Replacing a dental bridge at a dentist in this country would cost them more than $5,000. My mother received the same treatment in Mexico for about $1,000. The doctor is U.S. educated. Understandably, his business is growing rapidly. And Ken writes, not only would I be willing to do it, I've done it. I've saved many thousands of dollars in dental costs traveling to Asia and Africa, and I actually managed to have a fun vacation in the process. Vacationing abroad is my current health care coverage, and it will remain so. If you didn't see your email here, you can go to my blog at CNN.com/Cafferty file. Look for yours there among hundreds of others. Wolf?